Hi, I am Dr. Nicole Vane of Moonlight Beach Dental. This whole COVID crisis has put everyone for a huge spin. Our practice, being a holistic practice, was already set up for success with so many extra protective measures in place to protect myself as a doctor and to protect our patients. And I wanted to share with you some of the protective measures that we have in place here that make us so unique and so special compared to other dental offices. First, I've always had P100 respirator masks that I wear. I've always worn them through mercury removal procedures. Now I wear them all the time when working on patients, and so does my team, to 100% protect us from the virus. The only bad thing is that it makes it a little more difficult to communicate with my patients chairside, but you will see us wearing these all the time. Check this out.
You might not get all of my funny jokes, but it's super safe.
The other thing you'll see us wearing are full coverage coats that come up and over the collar, and we change our coats now for every single procedure. So every time we leave the room, we are going to be changing our coats. We also wear protective headwear. I personally love my surgical caps that we change after every procedure to reduce aerosols. Now, I have a unique setup in each of my treatment operatories, including my hygiene room operatories, and I wanted to go through the flow of how we reduce all aerosols here in the office. First, I have a surgically clean air unit in my treatment operatories, and I also have different HEPA filtration systems set up throughout the office, including in our waiting area. The surgically clean air unit has a 13-level HEPA filtration and can filter down to the particle size of the virus. But what's different about it is it pulls that air in and through all those filtration systems, but also has a UV chamber. So it can kill any virus that wasn't filtered, if anyone was worried about that, out of the air, and it recirculates the air in the room every 5 minutes. Now, in the typical dental office without these filtration systems, there can be aerosol suspended in the air, as one of the theories, for up to 3 hours. In my office, it's clean every 5 minutes. So if you're in the room, it will be cleaned within less than 5 minutes of you leaving the room. In addition to the surgically clean air unit, I have an ozone generating unit that's cleaning the air that also has UV in it, and it has a cross ionizer, so it's releasing negative ions which will kill and be attracted to the virus. I also have 2 dental air vac units, which are negative suction vacuums that are placed at the chest of the patient next to their chin that suck away any aerosols. In addition to that, I offer a nasal hood to the patient want to wear oxygen so they're not exposed to anything in the operatory. And I also have a special suction system for the mouth called the IsoDry, which is a mouthpiece that has built-in suction in addition to my patient being suctioned by the assistant. Or I'll use the rubber dam to isolate the mouth so that I'm only working on the tooth and none of the oral fluids are coming up. And we also have a significant number of barriers that we're putting on ourselves and over all of our equipment in the room. In addition to that, we have a thermometer, a touchless thermometer, which will be taking the temperature on each patient. We will be pre-screening you. We have a pre-screening questionnaire to make sure that no one has been exposed or had any symptoms in the past couple of weeks. We also have ozone water rinse, a fresh ozone machine. So it's an ozone and peroxide rinse that we have people pre-rinse with. And the ozone and peroxide destroy the lipid capsule on the virus, actually making the virus dead and inactive instantly. So we have people rinse with that before we even work on them. We've also converted everything to being paperless. We were paperless before, but now we can text you your paperwork. We can text you so you can wait outside. We have a waiting area outside, or you can wait in your car. All of your paperwork, we can text you all of your financials. We can take care of everything outside of the office, so that all you have to do is be escorted into one of our surgically clean suites and receive your treatment, and you can exit back out through that treatment and not interact with anyone other than our protected team. So I completely want to validate your concerns in coming in, but I do want you to know that you're completely safe when you're receiving treatment. These are just a few of the things that make us extremely unique and make me so proud to know that myself and my team and my patients are safe here at Moonlight Beach Dental.